Tired of staring at screens?
Let audioread.com turn your reading list into a private podcast.
With just 2 clicks, convert articles, PDFs, emails, or any text into audio you can stream in Apple Podcast, Spotify, or YouTube Podcast.
Perfect for multitaskers, podcast lovers, and productivity pros. Use the web app, browser extension, iOS shortcut, or Android PWA to listen anywhere. No installation required.
Highlight, upload, or forward content, and Audio Read does the rest.
audioread.com, or find the link in the show notes.
Hi, I'm William,
And I'm Kat,
and that makes this Info on the Go.
answering questions you want to know.
So, Kat, have you ever heard of black box medicines?
No, I'm intrigued.
Okay, so I'm going to try to set this up. The term black box drugs refers to prescription medications that carry the FDA's most stringent safety warning, a bold, black bordered box prominently displayed on their labeling.
This warning isn't cosmetic. It's meant to catch the eye and alert healthcare providers to serious or life-threatening risks associated with the drug.
So these risks might include severe side effects, potential for death, irreversible conditions, or complications in vulnerable populations like children or pregnant individuals. I think that's huge. I mean, the potential for death.
Right, or pregnancy complications and maybe even disformities. Unlike standard safety notes buried in fine print, a black box warning acts as a visual and informational red flag.
It doesn't ban the medication's use. It simply signals that prescribers may exercise heightened caution when considering its benefits versus its risk.
Examples range from antidepressants linked to suicidal thoughts in youth to powerful cancer treatments with dangerous immune responses.
So, today on this podcast, Kat and I are going to explore the world of black box drugs through 3 key lenses.
First, the regulatory process behind issuing these warnings, how the FDA makes its decisions, and how pharmaceutical companies respond.
Second, the medical and ethical implications for doctors, patients, and drug manufacturers.
And third, the controversies that swirl around transparency, delayed warnings, and corporate influence.
So, by understanding how high risk drugs are flagged and managed, so we're going to open a broader conversation about safety, accountability, and informed decision making in modern medicine.
The term black box warning refers to the boldest safety alert in the U.S. The Food and Drug Administration can assign a prescription medication.
It was formally introduced in 1979 as a way to visually distinguish high risk drugs from others.
The warning is literally enclosed in a black border on the packaging insert or labeling, hence the nickname.
Its prominent placement is designed to grab the attention of physicians and pharmacists, ensuring that they recognize the potential for serious or life threatening effects before prescribing or dispensing the medication. I'm pretty sure that doctors and pharmacists, which are pharmacists are doctors of pharmacology, right?
Right.
I think they have to take a full class just on black box medications and how to cancel patients whenever they see these come through.
To earn a black box, a drug must meet strict criteria, typically involving
Severe adverse reactions, such as organ failure, suicidal ideation, or life threatening allergic responses.
potential for death or irreversible damage, especially when the drug is misused, combined with other treatments, or administered to vulnerable populations.
This classification doesn't prohibit the use of the drug, it simply signals the highest level of caution needed. And I know we said that a second ago, but I think we just needed to drive it home, right?
Right. Very important.
Yes.
And it affects real world decision making. Doctors must weigh risk against benefits more carefully and may need to closely monitor patients or obtain informed consent.
Several well-known medications carry black box warnings. For example,
Antidepressants, particularly SSRIs and SNRIs, are required to include warnings about an increased risk of suicidal thoughts and behavior in adolescents and young adults. This doesn't mean the drugs aren't effective, rather, it prompts careful dosing and monitoring.
so isotretinoin or Accutane is used to treat severe acne, carries a warning for extremely high risk of birth defects if taken during pregnancy. Patients often must enroll in a risk management program before using it.
Clozapine, an antipsychotic for schizophrenia, can cause a granulocytosis, a rare but dangerous drop in white blood cells. Regular blood tests are mandated to catch this side effect early.
Hmm. In essence, and there's more drugs, but we're not going to cover them all. So, in essence, black box warnings act as red flags in a sea of pharmaceutical options, reminding everyone involved that with great power often comes great responsibility. Thank you, Spider-Man.
The process of issuing a black box warning is one of the FDA's most critical regulatory tools, designed to safeguard public health while still allowing access to potentially life-saving medications.
So basically, it's a balancing act between risk and benefit, urgency and caution.
Black box warnings don't appear overnight.
No, they don't. There's a process, and we're going to talk about it. So, the FDA typically reviews a combination of evidence, including clinical trial data, case reports, and epidemiological studies.
During the drug process, any signal of severe adverse effects may prompt early warning discussions.
However, many warnings are added after approval, once larger populations begin using the medication and rare side effects emerge.
When there's sufficient evidence to suggest serious risks, such as death, permanent disability, or hospitalization, the FDA consults with advisory committees, medical experts, and sometimes the pharmaceutical company itself.
Wow, I think that's a huge call out for the FDA in these black box medications, right?
Right.
Yeah. So if the consensus supports stronger caution, the agency mandates a black box warning and requires changes to drugs labeling, prescribing information, and promotional materials, which I think if it's going to be promoted on TV or wherever it is, I think it should that black box regulation should pop up with it. This is a black box medication, right?
Right. Black box warnings are often the product of data collected from three primary sources.
So the first one is data clinical trials. Early stage trials may uncover side effects, but often have limited diversity and sample size.
Post market surveillance. Once a drug is widely distributed, systems like PAERS or FDA Adverse Event Reporting System help monitor complications from real world usage.
So let's explain a little bit about that. So the adverse event reporting, doctors, patients, and manufacturers report unexpected outcomes. Patterns across reports may prompt investigations. So basically, if you're having a side effect from these drugs, you need to report it to your doctor, to your prescriber, to your pharmacist, whoever that you're having these, or to the manufacturer itself, so that it can be properly documented, right?
Right. The things you know when you know them.
Yeah, absolutely.
These surveillance systems are crucial, especially for long term or population specific risks that may not surface during controlled trials.
Hmm. A black box warning isn't necessarily permanent.
The FDA periodically reevaluates safety data and can add, revise, or even remove warnings based on new research.
For example, as drug formulations change or new risk mitigation strategies are developed, like mandatory screenings or patient registries, the warning may be softened.
On the flip side, if further evidence reveals greater danger, additional warnings may be layered on.
Yeah, so this dynamic review process reflects how science evolves over time and how the FDA strives to respond accordingly.
Not all dangerous drugs are pulled from the market. In many cases, the benefits for specific patients outweigh the risks.
Yeah. So, for example, a chemotherapy drug may cause severe side effects, but its potential to treat aggressive cancer justifies its continued availability, but with strict safety labeling. You know, I would agree to an extent with this, and I think the patient really needs to be informed, bef really informed about the dangers before really committing to this.
Right.
I mean, I'm just saying, I mean, I don't know. I mean, sometimes I don't think all the information is available to the patient at the time that a drug is being prescribed.
Nope. And I feel like some prescribers just want to write a script and let you go on your merry way.
Yeah, I think really asking open-ended questions, this is the basis of the show, being curious. I think asking open-ended questions about the side effects versus the benefits of a particular drug, uh, I think as a patient you need to be informed.
Yeah, even if the patient doesn't ask open-ended questions, they should be informed.
Absolutely.
Because I'm not really good at asking open-ended questions when it comes to talking to anybody,
Yeah.
period.
I know that if the pharmacist sees it, sometimes they're prompted to question a patient, especially looking at their drug history or prescribed history, especially if it's a doctor they don't know of. I know if they see these come up, they're prompted to cancel that patient in the moment. But I think it starts when it's being prescribed as well.
The FDA opts for black box warnings over outright withdrawal when
The risk is manageable with proper screening and monitoring.
alternative treatments are less effective.
The drug is essential for certain rare and critical conditions.
This approach keeps high-risk medications available under carefully controlled conditions paired with informed consent and close medical oversight.
So, the presence of a black box warning has a profound ripple effect in the medical world, reshaping how physicians prescribe, how patients understand their treatment, and how ethical boundaries are navigated, especially when lives hang in the balance.
For doctors, a black box warning raises the stakes.
Prescribing such a drug requires careful deliberation, often involving extra documentation, close monitoring, and a detailed patient consultation.
Many physicians may opt for alternative treatments if available, while specialists might still rely on high-risk medications when standard therapies fall short.
So the warning acts as both a signal and a safeguard. It reminds clinicians that their clinical judgment must now factor in potential severe harm for their patients.
Black box drugs elevate the importance of informed consent to a central role in patient care.
Patients must not only be made aware of the medication's intended benefits, but they must also be aware of the potential grave consequences of the medication.
This involves honest, jargon free dialogue, shared decision making, and where applicable, written acknowledgement of the drug's risks.
So, for example, with Accutane, patients must often have to sign consent forms and enroll in a specialized program that verify understanding and adherence to safety protocols. And I can say that when you go to pick up Accutane from the pharmacy, if in at least in the state we live in, the pharmacist must verify with the patient that they have adhered to the program and signed up for this program.
Physicians frequently face ethical quandaries when prescribing drugs with black box labels.
One of the most challenging scenarios involves choosing between a treatment that possesses serious risk and doing nothing, especially in cases of severe illness where the drug might be the only viable option. I would not want to be in a prescriber's shoes with that. Like, I think I would have to sit down with I'm not a doctor, didn't go to school to be one, but I think I would have to sit down with my patient and be like, look, this is a viable option, but here's the the risk. And I don't know. I don't think I could balance that
Right.
personally. I don't think I could. I have much respect for doctors. So if you're a doctor and you're listening, I just want you to know I have much respect for you for being able to make that decision or an informed decision.
Big props if you actually listen to your patients. Like,
Yeah, actually, yeah, for real.
should a doctor recommend a medication that might cause fatal side effects if it's the only path toward remission or stability?
So these decisions often require input from medical ethic boards, especially when risk disproportionately affect already vulnerable patients.
Black box warnings are particularly crucial when it comes to children, the elderly, pregnant individuals, and patients with coexisting conditions.
So these groups often respond differently to medications and adverse effects may be amplified. And before we get into those examples, Kat, I say we should take a break right here.
Hey, William, I think we should take a break.
Okay, let's do it. Hey, Kat, Old Glory, they've been operating since 1969 and they have over 300,000 items to choose from.
Wow. So we're talking like music or what are we talking about?
We're talking about music, sports, and pop culture gear. And we're not just talking about modern day stuff either. We're talking about bands like the Beatles, Metallica. They have hoodies, tees, gifts, and so much more.
Wow. Do they also do those old nostalgia TV shows?
Not just the TV shows, but the movies as well. And if you know that sports fan, they got you covered there too.
That's exciting. Do we have an exclusive code?
Absolutely, we do. It's called InfoGo. So check it out at oldglory.com. Use our code to get an exclusive 15% off. Don't forget, that's InfoGo, oldglory.com, or just click the link in the show notes.
Hey, William, do you get too hot at night?
Are you kidding? We live in Georgia.
Oh, right. Okay, me too. But I found site cozyearth.com where they make bamboo bedding. It's cooling, breathable, and buttery soft.
Tell me more.
Well, they have a 100-night free trial and a 10-year warranty. And there's also free shipping on orders $50 and above.
Tell me you got an exclusive offer for our listeners.
Absolutely. There's 41% off site-wide with our code INFOGO. And remember, that's cozyearth.com.
Yeah, so make sure you use our code InfoGo at checkout to get that 41% off. And we're back.
For example, antipsychotic medications used off label in elderly dementia patients carry increased mortality risks, prompting difficult discussions between healthcare providers, caregivers, and families.
I mean, man, that's a tough decision too, especially if you're a caregiver of one of these dementia patients and they have this medication that could potentially help them. Does the benefits outweigh the risk? I would not want to make that decision.
Right.
These are some tough choices people are having to make. In such situations, personalized medicine and multi collaboration are essential to weigh safety against necessity. Again, I couldn't even begin to put myself in somebody's shoes that had to make these kind of choices.
No, no, but those are usually specialists or something, yes?
Yeah, well, yeah, I guess for the off-label, maybe not. It could be a family doctor that's prescribing these.
Well, I reckon anybody who can prescribe stuff should, can prescribe stuff.
Yeah, but what I'm saying, yes, yes, true. I get what you're saying. But I mean, you got to bring it back to the family and
Yeah. Have
I
that
don't,
hard conversation. Well, yeah, especially if somebody, sorry, I was missing the whole dementia part because you're making the decision for somebody else.
yeah, that can't
And
really make that decision.
right. And you can't, it's really hard to know what they're feeling because they can't really describe it themselves.
Yeah, absolutely.
That makes sense. So, black box warnings are meant to protect patients, but behind the bold border lies a world of complexity, tension, and controversy.
These warnings don't always arrive swiftly, and their very existence is shaped by regulatory pressure, public perception, and the flow of information. And the flow of information should be steady, and the patient should know exactly what they're getting into.
Some of the most high profile black box warnings were issued years after drugs hit the market, prompting criticism about regulatory lag.
A prominent example is risperidone, and the off-brand is Avandia. And it's A diabetic medication tied to increased risk of heart attacks.
Although concerns surfaced early on, it took years of internal studies, external research, and public outcry before the FDA added a black box warning.
Again, I mean, does the drug outweigh the benefit? I mean, I don't know here.
Right.
So similarly, SSRIs, selective serotonin reuptake inhibitors, face disputed warnings about suicidal ideation in adolescents. Some researchers argued the benefits outweighed the risk, delaying consensus and action.
This delay often stems from the challenge of linking rare but serious side effects directly to the drug, especially when confounding health factors are involved.
So again, you have to report all those adverse side effects because honestly and truly, I think it takes years to be able to develop. I know when drugs go through their FDA regulatory process, all this information isn't out there. And so that's really, you got to consult with your prescriber, your pharmacist, or whatever about these side effects because, and the manufacturer of these drugs, right?
And not
To,
just tell patients they might feel a little sleepy and it'd be okay.
yeah, so that they can help get the word out and help, make sure others understand what the side effects might be or the weighted risk there. But as a result, patients may be exposed for years before regulatory clarity emerges.
Pharmaceutical companies wield considerable influence, and their financial stakes in high profile drugs can lead to pushback when warnings threaten market viability.
In some cases, companies may challenge the FDA's interpretation of data, present counter research, or lobby for softer wording.
Internal documents have surfaced showing attempts to downplay adverse events or delay publication of negative findings.
Well, I mean, they have all this money tied up in the research. I mean, we did that in our cancer fighting robots when we talked about, how it really works.
Hmm.
So they have all this money tied up into this drug. I mean, yeah, they want to put it on market and try to recoup some of that. So I don't think all drug companies do it. It only takes one bad apple to spoil the whole barrel. This dynamic creates a tension between corporate interest and patient safety while the
While
FDA.
the FDA is committed to unbiased oversight, the process is often complicated by negotiation and data filtering manufacturers.
A black box warning, by its very design, instills a strong psychological impact.
For many patients, seeing that bold border creates a sense of alarm, even if the actual risk is rare or manageable.
So, this can lead to medication avoidance, non-compliance, or reluctance to begin necessary treatments. Media coverage and online forums may amplify the fear, sometimes spreading misinformation or failing to contextualize the warning's intent.
On the flip side, some patients may not grasp the seriousness, especially if the warning is poorly explained by their provider.
It's a delicate balance between empowering informed decisions and triggering panic or confusion. Again, being informed is probably one of the, if knowledge is one of the biggest superpowers there is, right?
Knowledge is power. So, the foundation of black box decisions depends heavily on adverse event reporting, yet these reports are often incomplete or missing entirely.
Yeah, I think patients may not link side effects to the medication or they might not report them to their healthcare provider, which I think is a huge miss.
Providers themselves may skip reporting due to time constraints or uncertainty about cause.
This underreporting creates blind spots in the FDA surveillance system, delaying recognition of patterns that could prompt stronger warnings. So, again, if you're taking a medication and you have adverse side effects, make sure you're reporting it. You have all these different venues to be able to do it. If you don't feel comfortable with the three, report it to the FDA.
Efforts to improve pharmacovigilance, such as apps for patient reporting or automated data tracking, are underway, but challenges remain.
Yeah. So together, these factors highlight why black box warnings, though critical, are not just medical tools. They're political, psychological, and societal flashpoints.
Black box warnings span a wide spectrum of drug classes, each with unique risks, and each managed through sophisticated strategies to minimize harm while preserving treatment benefits.
Prasugrel, a potent antiplatelet agent used to prevent blood clots after stent placement, carries a black box warning due to its heightened risk of bleeding, especially in patients over 75, those with a history of stroke or low body weight.
While effective in reducing clot related events, it can cause life threatening hemorrhage.
Physicians may carefully assess each patient's bleeding risk before prescribing consider alternatives in vulnerable individuals.
Many antipsychotics, especially second generation agents like olanzapine or risperidone, include black box warnings when used off label to treat dementia related behavioral disturbances in elderly patients.
Studies showed an increased risk of stroke and mortality.
Despite being frequently prescribed in long term care settings, the warning encourages doctors to prioritize non pharmacologic interventions and consult family members before initiating treatment.
Certain chemotherapy agents and immunotherapies are inherently aggressive, pushing the boundary between therapeutic benefit and toxicity.
Drugs like doxorubicin carry black box warnings for cardiotoxicity, while nivolumab, a checkpoint inhibitor, notes risks of autoimmune complications that can affect organs like the liver and lungs.
So, these safety warnings are essential in helping oncologists balance efficiency with safety and guide patients through informed consent.
REMS, or risk evaluation and mitigation strategies.
Mm. So, REMS are FDA mandated programs designed to ensure safe use of high risk medications. They can include prescriber certification, patient enrollment, medication guides and checklists, restricted distribution systems.
Okay, for example, Accutane is distributed through the iPledge program, a REMS that ensures patients understand pregnancy risks and undergo routine testing before refill.
Doctors rely on regular blood work, electrocardiograms, and mental health assessments depending on the drug's profile.
Electronic medical records often include alerts for black box drugs, reminding clinicians of required monitoring protocols.
Patient support services like nursing follow ups or educational materials help reinforce adherence and early detection of side effects.
These real world examples reveal the high stakes choreography of using potent medications responsibly.
Modern pharmacovigilance has transformed with the rise of digital health records, AI driven analytics, and real time surveillance platforms. Again, it's at your fingertips. Make sure you're reporting.
Right. Systems like the FDA's, FAIR's, and EMA's Endurovigilance now integrate global databases and user generated reports to detect safety signals faster than ever.
Algorithms can sift through thousands of data points to identify patterns of rare but severe side effects.
Public access to safety data has also improved, enabling researchers and even patients to monitor drug performance post approval, marking a shift from closed door assessments to shared responsibility.
I really like that part of it. Moving from that closed door to having a shared responsibility. I love that part of it.
I definitely appreciate some transparency.
Yeah. So, precision medicine, tailoring treatment based on genetic, metabolic, and lifestyle factors is revolutionizing how high risk drugs are prescribed.
Tools like pharmacogenomic testing can identify patients who metabolize drugs abnormally or are predisposed to adverse reactions, allowing physicians to adjust dosages or switch medications altogether.
This personalized approach minimizes a blanket risk, making black box drugs safer for those uniquely equipped to benefit from them.
Drug safety is increasingly viewed through international lens.
So, while the FDA leads the U.S. effort, agencies like the European Medicines Agency or the EMA, and Japan's PMDA offer their own labeling systems with some harmonization occurring under initiatives like the International Council for Harmonization or the ICH.
Though terminology varies, the global trend leans toward clearer warnings, standardized formats, and multilingual access to safety information.
Collaborative efforts are also pushing for unified databases to track cross-border adverse events, ensuring broader vigilance and faster response.
Black box drugs exist at the intersection of powerful innovation and profound responsibility.
So they reflect medicine's ability to treat the untreatable while reminding us of its potential cost.
This exploration highlights how regulatory safeguards, ethical practice, and patient awareness must work in tandem to uphold safety without stifling progress.
So informed decision making is the cornerstone of responsible drug use.
From doctors decoding dense prescribing labels to patients weighing benefits and risks, transparency and education are essential.
Embracing tools like pharmacovigilance, personalized care, and global safety standards. These all help ensure that these high risk treatments are delivered with precision and caution. I would take that a step further. The patient needs to be informed as well.
Absolutely, and always.
Yes.
Ultimately, the future of drug development depends not just on groundbreaking science, but on how carefully we listen to the lessons of risk.
So when innovation is tempered with thoughtful oversight, medicine doesn't just save lives, it respects them.
As it should.
Yeah. Um, I found this to be extremely informative. And I have a question for you. In doing this show, this is probably episode 90, 80, something. I don't know. Oh, I've lost count. But have you learned a lot from us doing this?
Absolutely. A lot about things around the world, too, not just here in the US.
Yeah, I mean, like everyday items. I didn't even know there was a standard. I know there's not a standard black box warning, but to know that these other countries are looking and labeling these drugs and offering it that chain to be able to communicate with one another, this is knowledge that, generations before us really didn't have.
Right.
Just think of its potential and what it can unlock.
Absolutely.
To me, this right here was one of those things that I'm going to pay more close attention to now.
Me too. But that's all I've got.
Yeah, that's pretty much all I've got to.
If you would like to support this podcast, tell a friend and help get the word out.
If you would like to help us keep the show going, you can do so at Patreon. You can find the link in the show notes.
William and I want to thank you for listening.
Yes, thank you so much.
Join the Facebook group and Info on the Go,
Share with us your show ideas.
or ask us a question.
Subscribe and follow us wherever you get your podcast.
Send us a text using the link in the show notes, or leave a review.
Yeah, leaving that review will help someone else find the show. You can also email us at,
infoonthegopodcast@gmail.com.
and yes, that is all one word. Till next time.
Stay curious.